Our different social identities and social groups we belong to determine our inclusion within society, and by extension, our vulnerability to epidemics. When it comes to stopping the spread of the virus, governments must respond quickly and forcefully. However, they must also look at all aspects of the life of their citizens, especially the most vulnerable, a family. They must therefore take these distributional ramifications into account while formulating their strategy. In order to assess the virus's reverberations in a healthy community, we're going to look at its impact on the city of Laoag's politics, health, social cohesion, education, environment, and economics in particular.
The COVID-19 crisis is having a deep effect on the local governance all over the world. During crisis, citizens expect governments to take bold actions, especially that lockdowns, quarantines, and social distancing are part of the practice nowadays. And the government of Laoag City is doing its best to extend help by giving out cash, distributing relief goods, giving vaccinations, distributing livelihood assistance, and in controlling the outbreak, hoping to help more for everyone's safety. Despite the unstoppable rise of cases, the government of Laoag City is strengthening its ability to respond to, learn from, and mitigate the impact of this pandemic.
Earlier this year, Laoag has been tagged to have a very high COVID-19 infection rate of 2.07% within the country, causing for the people to be locked again in the confines of their homes, safeguarding their health, especially those with compromised immune system. More so, that within the sector of health, the impact of this relatively increasing number was seen to be tragic. Hospitals are in red zone as its COVID-19 bed occupancy rate has already reached the high risk level 2. Access to health for some diseases are also a challenge for people because of the protocols existing upon the entry of the hospitals. While others had to take the risk of getting medical attentions, others had become more cautious and stricter on their ways of life, especially on dealing with their health.
Stringent on social distancing measures and further guidelines on the management of the COVID-19 situation has been made by the Executive Secretary of Malacanang. The regulation has presented these guidelines that all students shall remain in their homes during class suspension, mass gatherings shall be prohibited, alternative and flexible working arrangements shall be made, all travel shall be restricted, and a community quarantine shall be announced when needed, all of which affecting the social balance in the country. The city of Laoag is no exception to the law and hence was forced to follow the guidelines to protect every family's health at the expense of their social relationships, social support, and social well-being. UNICEF mentioned in their blog that coronavirus had a profound impact on socialization, how we go about our usual daily communication, socializing, playing, learning, how we interact with each other and learn to behave in a way that is acceptable to society. Such words hold truth as children aren't able to meet with their friends in and out of school, mothers are unable to meet their next-door neighbors, fathers can't hold Friday night inuman sessions with the gang, and the elderly aren't even allowed to step out of their homes.
Aside from that, the COVID-19 pandemic showed how solid policies, timely interventions, effective allocation of resources, and methodical priority setting may significantly affect the way our nation survives the crisis. The virus continues to ravage our country today, and education is one of the sectors that is severely affected. For instance, the production of learning modules in time for the opening of classes forced educators to find additional funding of sources for the printing and reproduction of these modules. Some teachers had to cross rivers to distribute these modules to the homes of their students, while other education institutions needed to suspend their remote learning activities because not everyone has access to the needed facilities. most especially to the students from the poorer families. So furthermore, pushing through with classes had adverse effects on the mental health of students and teachers.
The global outbreak of COVID-19 is affecting every part of human lives, including the physical world. The measures taken to control the spread of the virus and the slowdown of the economic activities have significant effects on the environment, even with the climate change. Due to the movement restriction and a significant slowdown of social and economic activities, air quality has improved in many cities, with a reduction in water pollution in different parts of the world. However, the increased use and demands of PPEs, face masks, and hand gloves and their disposal has a negative impact on the environment. The COVID-19 pandemic has elicited a global response and make us united to win against the virus. Also, to protect the environment, united effort of the people should be imperative.
The pandemic has disseminated jobs and placed millions of livelihoods at risk, which pushed Laoag City to one of the worst economic recessions in decades. With low and irregular incomes together with the lack of social support, many are spurred to continue working even in unsafe conditions, thus exposing themselves and their families to additional risk. Millions of families are facing hunger before COVID-19. How much more now that we are experiencing income losses, and for them to have foods on their plate, they resort to loans. With the reopening of the economy to start jobs, guaranteeing the safety and health of all is a big impact for better incomes and protection of saving lives and protecting public health, the people's livelihoods and food security.
A healthy community is composed of elements that can sustain the needs of a family. But since the start of the pandemic, it has been quite a challenge to keep the balance. For 3 years, the virus has pushed the country to a change that forced Laoag and other communities to take unfavorable actions. For physical safety, people are expected to follow protocols, take health risks, isolate themselves from others, learn behind screens, and face financial problems. But it still helped us in small ways, such as reducing air pollutants and practicing resourcefulness and unity. Hence, amidst the pandemic, we shall try to do what we can and maintain the health of the community of which we, our families, live in.